Health Minister Aaron Motsoaledi. Thank you so much for joining us, Doctor.
Yeah, thank you, Adriana, and thank you for having me.
Now, earlier you described the protest at Charlotte Maxeke Academic Hospital as unacceptable. Can you speak about that statement?
Yes, it is unacceptable because we are aware that in any democracy, especially ours, protest is allowed. People are allowed to go on strike, but there are rules which people must follow. What I saw during the day, I can't classify it as a labor action. I classify it as hooliganism. It can only be done by hooligans, not aggrieved laborers. Because no matter how aggrieved you are, you don't do the type of things we've seen in the day. Going to theater to stop people from performing operations, going to oncology department, dragging out people who have got cancer, or doctors who are treating people with cancer with drips, go to the dispensary and order the patients who are waiting there for medication to go away and not receive their medication. When the patient refused, then you drag the workers out and you even tell the patients that no, you remain there, who will serve you. Going to maternity and and dragging out pregnant women there. How do we call that a protest labor action? It is hooliganism, definitely. There's no other way of calling it. Actually, it's tantamount to murder. Because when you go around doing that to sick people, who have, by the way, got nothing to do with your grievances, the patients who visited Charlotte Maxeke have got nothing to do, absolutely, with whatever made the workers angry. It is not them, the patient, who might have caused that grief. Now, why should they be victims?
Now, staff at the hospital are demanding higher wages and bonuses, they say, are owed to them. They're threatening that the hospital will remain closed if the government ignores them. What is your response to this?
That hospital is not closed. I left that hospital at 7 o'clock. It was not closed. It's not working.
And then how do you respond to a strategy to be able to work with the workers?
Well, I don't mind when workers go on strike. They've got right to withdraw their labor power if they so wish. And the issues they are talking about are issues between them and Gauteng Department of Health. And the MEC told me they are resolving them. The issue I'm mentioning here is when you are working in a healthcare system, working with sick patients who are vulnerable, regardless of what your grievance is, what your labor grievance is, you don't do the type of things that I've seen. That's all I'm saying. As for how much Gauteng owes them, where they owe each other, they will settle between the two of them. But I'm worried about patients, for which we are there for. Even them, they couldn't have been working in the hospital if there were no patients. They are there for the patients. And so to go and disrupt their lives and handle them the way they did today is completely unacceptable. If they were justifiably aggrieved, maybe by government or by politicians, why don't they go and thrash offices of politicians? Why go and harass patients who don't even know what's happening, who have got nothing to do with what has happened, who came from home sick, expecting treatment and tender care, and you go and harass them like that and you say it's a labor issue? It can't be. It's sheer hooliganism, and police must deal with it.
So what is the way forward, Dr. Aaron?
I don't understand what you mean by the way forward. Gauteng Department of Health has got a standing meeting with these people to resolve these issues. And the way forward is that patients must be left alone during labor disputes. Labor dispute must be dealt with the state. Patients who are sick must be left alone to get their treatment because they've got nothing to do with the disputes. That is the way forward. Any other way of doing, if they do in any other way and I've already phoned the Minister of Police that they must come in, because we in health cannot deal with hooligans. Hooligans are criminals. They must be dealt with by the law enforcement agencies, not us in health.
Thank you so much. That was Health Minister Aaron Motsoaledi speaking to us about the situation at the Charlotte Maxeke Hospital.